Welcome to Medica Nova Wellness Studio. I'm Dr. Angelika Maria Koch with your educational videos about optimal health and the most innovative and holistic approach to your well-being. In my last video, I talked about genital herpes and the indicated natural treatment protocols. And as we are addressing different kinds of sexually transmitted diseases, let's explore how you can manage and heal chlamydia with natural and effective therapeutic tools. Chlamydia is the most common sexually transmitted disease, but it is curable. It affects both men and women across the globe. And the challenge with the treatments or keeping it from spreading is that most people don't experience major symptoms, and so it makes it more difficult. So testing is really important here. So in this video, I will give you all the info you need to know how to heal chlamydia naturally. Enjoy this video. To stay updated with my ongoing videos, I encourage you to subscribe to my channel, share and like it with your friends and families, and don't forget to click that bell as it notifies you every time I upload a new video. And have a look at my website medicanova.net at the online academy, where you will find comprehensive certified home study online courses in homeopathy, in mental health, health and wellness coaching, quantum healing, and so much more. Also have a look at the wellness programs. We offer now a fantastic cellular detox system. It's the most advanced on the market right now. So if you need more information, contact me at health@medicanova.net. So what is chlamydia? Chlamydia is a common sexually transmitted disease, in short, STI, and it's caused by bacteria. We call it Chlamydia trachomatis, and is commonly spread through vaginal, oral, or anal sex. But it can also be passed on from the mother to baby during vaginal delivery if the mother is infected with infection. And there are certain risk factors that increase the chance of getting chlamydia. It includes having multiple sex partners, having unprotected sex with a person who might be having an infection, or having a previous history of an STI. Now, though chlamydia infection affects, as said, both men and women, it is most common more among young women. Now, since it spreads so easily, young adults should get tested regular, educated, treated, and also practice safe sex in order to sort of protect themselves from the long-term effects of chlamydia. Now, while statistics show that most those infected are younger, there are actually 1 million people in the United States over the age of 24 who have chlamydia, whether they know it or not. So unless you are in a monogamous relationship or were tested in the past, it is wise to have a test and just see if you're part of it. As a matter of fact, testing for chlamydia is very easy. It's a urine test, and your doctor will test if there's bacteria there. If your doctor suspects, then there will be a little swab taken, either from the eye, the urethra, the rectum, or the throat, because the bacteria can affect your throat as well. So what are the symptoms? Well, let's look in the women first. Usually you can see painful urination with burning, so you maybe think you have a bladder infection. It can be confusing here. Lower abdominal pain, vaginal discharge, it's quite common, painful sexual intercourse. There can be bleeding between your menses or your periods, bleeding after sex. Often there can be a rectal pain, there can be even a discharge or blood involved. Inflammation or infection of the eye, so it's not just maybe a conjunctivitis or you suffer from seasonal allergies, maybe there's more to it. If you have a persistent sore throat, check out, right? That could be part of it. Lower back pain. And if it's acute, maybe there's fever and nausea involved. Let's take a look among the men. What are the symptoms? Again, as with the women, we have painful urination or this burning sensation. It can be at the start of the urination, during the urination, or at the end of the urination. All can be part of it. The testes are usually swollen, testicular swelling. There's a tenderness or pain involved. We see maybe sometimes discharge from the penis, and that can be a cloudy, milky discharge to yellow-white or even a thick sort of consistency discharge. Can change, with the situation. There may be redness and itching and swelling at the opening of the urethra. Again, rectal pain, because the bacteria can affect the anus. There can be discharge, there can be bleeding involved. And again, check your eyes if there's a chronic infection involved, and again, your sore throat. So people having chlamydia are at a higher risk of other STIs, like gonorrhea and HIV, for example. Males are suffering from chlamydia. Maybe there's a risk of epididymitis or prostatitis. Arthritis is also connected to chlamydia. And again, it can affect the joints, it can affect the eyes, the urethra, or even the gastrointestinal system. But the most common complications are cervicitis among the women. It's this painful inflammation of the cervix that can cause vaginal discharge, bleeding, abdominal pain. Urethritis, where the inflammation of the urethra is involved here. Proctitis, where the lining of the rectum, of the anus, is involved. Pelvic inflammatory disease. It's quite a large sort of kaleidoscope of symptoms, and it can affect the uterus, fallopian tube, cervix, ovaries. It becomes very complex by then, but check out for that too. Tubal factor infertility, it is caused usually with pelvic inflammatory disease, like endometriosis, and then it maybe leads to tubal factor infertility, so check on that. As well, it was cited that ectopic pregnancy may be linked to that. So, as I said, there can be several factors. Chances of pneumonia even, or this serious eye infection in babies who contract chlamydia during delivery. Often because we don't see the symptoms, we say, oh, it's not really happening. But really look in the history of your sexual partners, what happened to you. And I'm going to talk a little bit in a minute about the mental, emotional story behind chlamydia as well. So what would be the conventional treatments? Well, once you're diagnosed, you get an antibiotic, usually for 5 to 10 days, depending on the severity of the infection. And of course, until you have completed your course of antibiotics, you have to refrain from any sexual contact. But it is a little bit of a band-aid situation because, first of all, you want to treat the totality of you, right? Your immune system, your susceptibility, the whole story. So, first of all, you're not so prone to it anymore, and really treating it from the roots upwards rather than putting a band-aid on. So keep watching the video as I will share more and vital information on how to heal chlamydia with effective and natural treatments. If you're interested in a health consultation, either for yourself and or your children, contact me at Medica Nova at health@medicanova.net. Medica Nova is my practice for integrated and educational medicine. We offer a unique blend of natural and cutting-edge therapeutic tools from homeopathy, iridology, sclerology, systemic herbology, advanced biofeedback, and health and wellness coaching, and so much more. Book your appointment today. Let's move to the second part of this video, the food for thought section. It's the metaphysical meaning. As a healthcare practitioner, I'm interested not just in your symptom, but who are you? Right? What is your story? What's happening in your life? What is the stress? What is the mental, emotional stress which causes your body to react? And of course, with sexual transmitted diseases, we have to have a look at your relationship and perspective to your sexuality. What's happening with your spouse, with your lover, with your intimacy. I always here refer to Jacques Martel's book, The Complete Dictionary of Ailments and Diseases. He really has a nice little summary about what could cause, chlamydia on the frequency level. So venereal diseases can suggest that a feeling of guilt subsists about my sexuality, right? You don't feel so free, you don't feel so comfortable with it. Often my religious education portrayed sexuality as something maybe dirty or impure. Feeling ashamed of my thoughts and actions, often betrayed by the other two or who transmitted the disease to me. There's this feeling like, God, I'm really angry about. I never should have had a relationship with this person. He didn't tell me, or she didn't tell me. I believe I must punish myself by rejecting my genitals. I punish myself by destroying myself, right? That's a thought which we don't want to entertain for too long. Sexual energy is extremely important and powerful, and it is an integral part of my genetic program for the survival of the species. And therefore, a venereal disease involves an illness or an infection related to this energy. If I underestimate it or abuse it or use it negatively or in a way that does not respect who I am and who others are, the others are always involved, my body warns me by developing a venereal disease. So does my sexuality suit me? And more importantly, do I feel well and flourishing with the person with whom I share my intimacy? You have to be honest here to yourself, right? It's like, don't put this under the carpet. This is important. Your body, your health is your wealth, right? So do I respect myself, or do I feel I'm being abused? When it gets to this level of abuse, you have to wake up. You have to speak up or change your life. There's no, bargaining here anymore. My non-acceptance of myself may even lead me to experience rejection and frustration and feeling more in control over my impulses. I catch a venereal disease that forces me to stay away from any sexual contact for some time. Right? That can be a part of it too. I might also attract this disease. It's hard to hear that, I may even attract this disease, that there's a part of me which maybe is susceptible to it, right? And we want to really look at this. What can you do in order not to have that or let this happen on the cellular level? So I may even attract this disease to myself to get revenge on my spouse when I feel that he has already abandoned me emotionally. I no longer venerate anything in him, right? It's almost like I venerate the venereal disease. Right? It's almost, we do this subconscious. It's like, there are quite a few cases in my practice where I remember where maybe the woman has constant period pains or abdominal pains, and which then, sort of doesn't invite her to have intimacy with her partner. But deep down, she's actually quite happy. She doesn't need to have intimacy with her partner because of the abdominal pains. You see, it's a catch-22 here. So in the case of chlamydia, I'm afraid of the power, especially the sexual power, that could lead to abuse, to be abused, or even to abuse the other. I feel guilty when I feel my impulses. I'm afraid as much by what is inside of me as by what is around me. So what is the frustration that is bothering me in my sexual life? Is my body expressing something that I would feel like telling my partner about? As I said, be honest to yourself and to your partner. So what would be the positive affirmation? Well, we start by accepting that sexuality is a way to express my love and my desire to join the other. You accept that you maybe have fears about it. You accept and invite this. There's nothing wrong with you, mentioning or sharing with your partner that you feel not quite sure about yourself, right? And you want to explore that rather than giving into the intimacy if you don't feel you're really there. I learned to see what is good for me and what no longer suits me. I accept to contact my inner feelings so that my relationship will be true and healthy. I use my sexual power positively in order to enable all my creative energies to flow in me. I choose to re-examine my position in my affective and sexual relationships. And I allow new ideas to flow freely, and I keep an open mind. I adjust my way of thinking, and I accept that this experience is a means for me to grow and recover my affective balance. So chlamydia maybe is a sort of invitation. I don't like the word like, warning bells and all that stuff, because it just creates fear. It's an invitation to look a little bit deeper. And if you want to go more deeper, here I am for you at Medica Nova. If you want to explore more about yourself, your wellness vision, what motivates you, and how to apply your strengths in achieving the very best of you, contact Medica Nova Wellness Coaching at health@medicanova.net for your 3-month coaching program. I am coaching you to be well. So let's talk about the natural treatments. Let's be hands-on and let's tackle this situation. So at Medica Nova, I always suggest effective herbology and homeopathic remedy. I think this holistic combo will not only take care of the acute symptomatology, but also will boost the body's natural defense mechanism, boost your immune system to fight the bacterial agents and bring about natural recovery in chlamydia cases. So let's talk about herbs. Golden seal is a wonderful, wonderful herb here. And according to an article in the Alternative Medicine Review, the plant alkaloid berberine found in golden seal demonstrates significant antimicrobial activity against viruses and bacteria, including chlamydia. Also, in a small clinical study, chlamydia of the eye resulted in no relapses even 1 year after treatment with eye drops made from berberine. So it's definitely something to explore here. When fighting an infection such as chlamydia, golden seal pills or capsules or extracts can help. They say 6 grams per day in tablet or capsule form is a typical recommendation, or 2 millimeters of an extract 3 to 5 times per day. You can take it straight in your mouth or mix it up with some liquid. They do say golden seal should not be taken longer than 3 to 4 weeks. Another one on my list, which I highly recommend, is echinacea. Wonderful, strong plant, has been found highly effective against STIs, and including gonorrhea and chlamydia. It stimulates the immune system. I would say 10 milligrams per kilogram of the body weight over 10 days with a combination of golden seal is highly recommended. Garlic, yeah, simple kitchen pharmacy, who would have known? Researchers have found and identified allicin as the compound in the garlic that has antibacterial, antiviral, antifungal, and antiprotozoal features. Now, the best results consume or chopped or crushed garlic, but leave it out for about 10 minutes because it allows the enzymes to morph into bacteria-fighting allicin. And if you don't want the fresh garlic, get yourself some garlic capsules. Usually they have parsley in there, and take it on a regular basis. Oil of oregano. Medical grade oregano is distilled into an essential oil, and it creates then oregano oil. It contains thymol and carbapenem. It's a healing compound and a natural infection fighter. It's very, very strong. So most people tolerate oregano oil very well, but it's, as I said, it's very potent, and you maybe want to get it in capsule form. Pregnant or breastfeeding women should avoid oregano oil because it's too strong. But hey, it's so powerful that it quenches the bacteria quite fast. Because the intestinal system is also affected, I would suggest some probiotics here. Your gut microbiome is your defense, your immune system, your nervous system. Your gut is actually the first place where any disease really starts to take form. And I would really recommend, highly recommend, to take care of your gut here. I would say, particularly if you're on antibiotics, your microbiome will be affected no matter what. Let's talk about homeopathic remedies. In this video, I like to suggest homeopathic remedies you are able to purchase online or in your local health food store, so it's nothing too complicated. If you need more guidelines, of course, contact your healthcare practitioner, but also contact Medica Nova at health@medicanova.net to schedule your appointment. I'm happy to help you. For adults, the dosage plan, depending on the severity of the condition, I suggest one globally. It's this white little ball or the pill, maybe, 3 times a day for 10 days in the potency 30C. That is the number behind the name of the remedy. The idea is here that you are looking for your keynote individual symptoms of your chlamydia. Remember in the beginning of the video, I talked about that there can be several symptoms involved, like pain on urination, bleeding from the anus, itching of the vagina, discharge milky to yellow to green, right? So what we want to sort of explore here is, what is your keynote symptom? Is it the bleeding from the rectum, or is it the itchiness of the vagina or the penis? And when you have established that, then you match the symptom with the keynote symptoms of the homeopathic remedy, and then you have a lot of success, right? You have to find the right match here. That's the idea. The first remedy with the keynote vaginal discharge is Sepia officinalis, especially among women. Again, the potency 30C, and sepia is highly beneficial to manage discharge in cases of chlamydia infection. The discharge can be yellow, green, clear like water, or milky white colored. Vaginal discharge may get worse after urinating. The discharge may be acrid, excoriating in nature, so there's a lot of itchiness involved, burning sensation in the vagina. The discharge may also have a fetid smell to it, quite strong. There may be frequent urination present, and this bearing down pain in the pelvis is quite marked. Also, there can be complaints with painful coition or intercourse. Now, the mental emotional story with sepia is quite maybe interesting to you. Sepia is a woman who is exhausted. Maybe is a high-powered businesswoman, runs a really dedicated job but has 3 kids at home and has a lot of responsibilities on her plate. And so the intercourse or the sexuality is not really on the top of her list. So there can be a feeling of indifference to the loved one or even towards her children. It's not lack of love. It's just this kind of indifference based on exhaustion. And then she experienced maybe reproductive symptoms, or in this case, venereal disease like chlamydia. If the emphasis is more on offensive vaginal discharge, the remedy is creosote. And it's a whole stage more intense, where the vaginal discharge in chlamydia is very putrid in smell. There's a color, yellow and white. The discharge may be acrid. It's corrosive in nature. It causes itching in the genitals. It maybe even is so strong that it runs down the legs. Sorry, I'm being so blunt, but we want to really understand the nature of these remedies. There's soreness and burning in the genitals after scratching even, stitching pain, smarting sensation in the vagina. And the discharge gets worse on standing or walking. And with creosote, you see this great weakness which appears along with the mentioned symptoms. We talked about painful intercourse in females. And Natrum muriaticum is a wonderful remedy here. It's very indicated, as I said, for painful intercourse, burning pain, smarting sensation felt in the vagina during the coition even. Soreness and itching in the vagina may also be present. And with it comes the dryness of the vagina. Of course, menopausal women experience that more so. But Natrum muriaticum has a very strong affinity for that. The discharges may be transparent, more watery, more milky, and there is this intense debility appears along with this copious vaginal discharges like creosote. But the emphasis with creosote is more the vaginal discharge, whereas with Natrum muriaticum is more the dryness of the vagina. If Natrum muriaticum doesn't give any results after 10 days or 2 weeks, then switch to Sepia officinalis, which is also indicated for dryness of the vagina. We talked about bleeding following intercourse, right, either from the vagina or the rectum. Argentum nitricum, 30C, is a fantastic remedy here. Intercourse is painful and profuse yellow vaginal discharges, and sometimes the vaginal discharges are therefore blood-stained. Argentum nitricum is a wonderful remedy. In males, let's go to the males as well. If you see a milky fluid urethral discharge coming out, Petrocelium 30. This remedy you maybe have to get online. It's not in the health food store. Again, in males, we see this milky fluid discharge from the urethra, along with itching and biting sensation. In some cases, there can be drawing or this crawling sensation in the urethra. Definitely frequent desire to urinate, along with this marked urgency. Petrocelium is a wonderful remedy, small little remedy, but very effective. In males, if you see a yellow watery mucus urethral discharge, you think about cannabis sativa. Yes, it is made from cannabis, but in homeopathy we're not talking about the actual substance, we talk about the frequency. It's a valuable remedy here. When you see yellow, but it has to be sort of watery mucus discharge from the urethra. Along with this, there's this dragging and aching in the testicles. There may be burning while urinating or straining to pass urine, but there's not much coming out on the urination. Stitching pain in the urethra may also accompany the symptoms. Cannabis sativa is a wonderful remedy for yellow, watery, mucus-free urethral discharge in males. If the discharge is more yellowish and thick, then you think about pulsatilla, and that can be in males as well as in females. Pulsatilla nigricans 30. Fantastic remedy when you see this yellowish green discharge from the urethra, and it's quite thick. Along with this pain, there's this swelling or burning sensation in the testicles. In general, if you feel you have none of these symptoms, what I just shared with you, but one of them really stands out, which is this frequent urination, painful urination, either at the start of the urination, during the urination, or at the end of the urination, Cantharis is a wonderful remedy, 30. You will get that online as well as in the health food store. Cantharis is indicated for this burning, painful urination in chlamydia infection. Pain and burning arises while urinating. It may also be there before or after urination in many cases. So, the beauty is with Cantharis, it really covers all three situations, either before the urination, during the urination, or after the urination. The pains are quite cutting in nature, and the frequency of urination is prominent, is also increased, and the urine may be scanty. Urine may contain maybe sort of jelly-like, shreddy sort of particles sometimes. It's a great remedy for that. Also is one of the major remedies for UTIs in general, for bladder infections. I also can highly recommend a product which you can get at the website Best Made Natural Products. They have a product called Gynecological Infections Chronic. It's called BM240. It's based on biochemical homeopathic cell salts or tissue salts, and that works quite well as well. Of course, homeopathy offers many more remedies. We have Mercurius, solubilis, or rhododendron, for example, if you have pain in the testicles. So it really goes into the keynotes, but you can see, and that's what this video is really about, that you can heal chlamydia. You don't have to be ashamed about it. You don't have to feel guilty about it. You don't have to not talk about it and put it under the carpet. You can deal with it in your own way, and in a much more in-depth nature as well. So of course, if you need more guidelines, contact Medica Nova at health@medicanova.net and schedule your appointment. But I hope that this video has given you a little bit more inspiration and sort of also, more oomph to tackle this situation in your own way. Lastly, take a look at my website, medicanova.net, at the online academy, where you will find comprehensive certified home study online courses in homeopathy for the whole family. If you want to know about more, how to treat your loved ones, your children, your spouse, your family, as well as yourself. I also have a course for homeopathy specifically applied during pregnancy, birth, and postnatal care. A wonderful course for health and wellness coaching. If you really want to be a coach, you need all the ingredients for it and the foundational information, as well as a course for integrated mental health. Here we talk about depression, anxiety, Alzheimer's, or neurological disorders and what to do about it. Or a course, Being and Living Quantum Healing, which is based on my book, The Dance of Your Core Healing, Transforming Your Mind, Body and Soul in the New World. So there's a little bit for everyone out there. Would love you to subscribe to my channel. so you get more information, and ring the bell, of course, so it notifies you every time I upload a new video. And till next time, much love. Take care.